So for today, we are going to be talking about AASLD Hill Day Asks. We'll explain what Hill Day is and everything, and try to give you a framework for the advocacy efforts of the American Association for the Study of Liver Diseases. We will talk about previous and current advocacy activities that AASLD undergoes and their collaborations with other liver advocacy organizations and how coalitions develop around the issues. And then we're going to have a moderated discussion with our two distinguished moderators, who I'm going to introduce you to in a moment. And during that time, we'll have time for Q&A as well. So today's speakers from the Public Policy Committee, I'm happy to welcome Andrew Scott, the Policy Director for the Global Liver Institute. Andrew is a longtime policy professional. He has extensive experience in government affairs and advocacy strategic plan development. He undertakes proactive legislative and regulatory initiatives which elevate patient-centric viewpoints while simultaneously advancing community goals. And he has career experience in health policy, pharmaceuticals, medical devices, government affairs, and patient engagement and advocacy. So welcome to Andrew. I'd like to also introduce you to Rhea Racho, who is the Public Policy and Program Manager for the Hepatitis B Foundation. She manages HBF's patient storytelling program and helps implement policy and grassroots advocacy efforts to improve hepatitis B prevention, treatment, and access to care. She advocates for the increased funding for hepatitis B programs and research and reducing health disparities and discrimination associated with hepatitis B. Rhea has previously worked for the American Heart Association as a project coordinator, and she has a Master of Public Affairs from the University of Texas at Austin and a BA in International Studies from Baylor University. So welcome to both Rhea and Andrew. And from here, I'd like to go into a couple of housekeeping things. Ground rules for today are very simple. If possible, please save your questions for the moderated discussion period. Please mute yourself unless you're speaking, and please use the chat or the raise hand feature. And then we will be asking you for feedback on this webinar. I'll be sending out a brief survey. Please give us your feedback. We really want to make these webinars as informative and valuable and engaging as possible for the patient community. With that, I would like to introduce also our moderators, Donna Cryer, who's the President and CEO of the Global Liver Institute and a longtime liver advocate, as well as Michael Ninberg, most recently, I believe, President of the Hepatitis Education Project. Both Michael and Don are longtime patient advocates, and they are also members of the Patient Advisory Group for AASLD. So I'd like to welcome both of them. And I would now like to turn it over to Andrew Scott to begin our presentation. Go ahead, Andrew.
Thank you, Mike, and thank you everyone for joining us today to take a look at how we develop and how we work collaboratively in developing a liver health policy agenda with AASLD. And let me go ahead and bring up my slide deck. So I'm going to start with providing a little bit of an overview of how we reach or how we end up deciding on the specific policy priorities. For those of you that are new or attending this meeting for the first time, our first, or I shouldn't say our first, but our Liver Advocacy Day with AASLD happened last week. So this is all going to, I'm going to kind of paint a picture with that in mind and how the Public Policy Committee worked collaboratively to develop a policy agenda that we could all get behind as part of the Liver Advocacy Day that happened last week. And then after I go through that overview, I'll shift into some of the successes that our organization has had with AASLD and really underline the value of collaboration between medical societies like the American Association for the Study of Liver Diseases and patient advocacy organizations like my organization, Global Liver Institute. So to start, This is really, in a nutshell, how we develop a policy agenda through the Public Policy Committee. We utilize a combination of internal and external insights. Internal insights can come from members of AASLD, but also in this case from the Public Policy Committee, and of course, representation of AASLD as well, who are active on Capitol Hill. And then of course, external insights would come from individual advocates, but also patient advocacy organizations like both the Hepatitis B Foundation and Global Liver Institute. And that's why it's so exciting with how AASLD has included patient advocacy representatives in the Public Policy Committee. It really ensures that there is kind of a collective agreement around a public policy agenda. So we get a combination of these two types of insights, we bring them to our meetings, and then through the committee meeting, the Public Policy Committee meeting, we develop a plan of action and we zone in on those specific policy priorities, which I will expand upon momentarily. And then from there, we then mobilize and advocate around those policy priorities. And in this case, the action that was taken, the advocacy action that was taken collaboratively, was the Liver Capitol Hill Day that happened last week. But this action can take many different forms. Some of the other examples that Rhea and I will go through are not always Capitol Hill days. They can be letters, comment submittals, specific meetings that are just with AASLD representatives and some advocacy organization representatives and more. And I should say even coalition work also that many of our organizations are part of also. So really there's a variety of tools, advocacy tools available to then mobilize on the policy agenda that is developed within the Public Policy Committee. And then I should also mention as well, it is critical that all of these tools are used. The Liver Capitol Hill Day is not going to be successful on its own. It is only successful as part of a larger advocacy movement, which is why it is so important when we look at some of the other actions that Global Liver Institute has taken with AASLD, or the Hepatitis B Foundation have taken, and other advocacy organizations have taken with AASLD. It is critical that there is that consistent drumbeat of liver advocacy. That is the only way that we will see success on Capitol Hill or in any other legislative body. So to kind of zoom in on the policy priorities that were just used in the Liver Capitol Hill Day, there are three main priorities. The first one being kind of a usual priority that we tend to utilize each year around raising funding or increasing the amount given to relevant federal research agencies like NIH, and also in this case, NIDDK, and public health agencies as well, like the Centers for Disease Control and Prevention and their Division of Viral Hepatitis. As you can see, we have some specific dollar amount asks. And this was, while this is an ask that we have almost every year, it is critical that we are unified in making it consistently because, as many of you are probably well aware of, passing a budget in Congress right now is a challenge, and getting the funds necessary to not only maintain ongoing research, but also launch and start new important research or public health initiatives is a challenge. So it is critical that we are unified as a community around elevating the amount given to relevant federal research agencies, federal liver disease research agencies. And then our other two asks are, well, I should say our second ask first is kind of connected to this first one. And it was also to include specific language about universal hepatitis B vaccination and alcohol-associated liver disease. Both of these two, the funding request and the language, are critical at this time of year during a normal Congress. I should say that obviously fiscal year 2022, as many of you just saw, just passed recently, which is very late for a normal congressional session. They should already be well on their way for fiscal year 2023, which is why they're moving so quickly now to get that passed or moving forward. And that's also why our asks right now are especially critical, because they are in the process right now of finalizing what the funding, federal funding, will be for the next year. And then finally, our ask was kind of a feeler ask we really wanted to try to think of how we can better touch upon the variety of liver conditions that impact so many of our organizations and so many diverse patient populations. How can we better have kind of a unified point to get behind? And that led to this final request, which is really to get Congress to start thinking about a liver health plan, really a department-wide, cross-agency, cross-federal department liver public health plan. And we hope to see kind of more specifics come from this soon. But hopefully with some of our meetings last week, we were able to start figuring out who our congressional champions might be. So these were kind of the three main asks. We should have more kind of specifics coming from these in the near future, but I'll mention as well that this is now going to build into what will be a part of other advocacy requests down the line. And it's why it's so important, again, that these asks don't live in a vacuum. They are part of a larger advocacy movement that is not happening siloed with AASLD or any other advocacy organization. And hopefully I'll have more updates soon within the last week. We'll see, if any other congressional offices or if this language has been taken into, the next appropriations report language and more. So we'll have more to follow on that. So now I wanted to kind of quickly shift over to some of the actions that GLI and AASLD have taken, and then I'll hand it over to my colleague, Rhea, or my peer Rhea. So to start, how we see the world and why we're so excited about how AASLD has also seen the world is really the importance of many of the points that I've mentioned previously: collaboration, patient-centric priorities, thinking of liver health holistically, and advancing community initiatives while also prioritizing specific pieces like report language that can be equally impactful for patients. So when we think of these kind of broad angles to public policy, we are excited that AASLD has joined us in kind of viewing the world this way, and especially the Public Policy Committee. As you saw in some of the priorities that we've developed, they hit many of these points. I also wanted to briefly highlight as well, this is how we have or hope to kind of maintain that drumbeat of liver advocacy after AASLD's Liver Capitol Hill Day. Not only will we sync our priorities up with the priorities that were mentioned last week, but we also look forward to working with, and I know some of you are on this call today that are part of our Liver Action Network. And as you can see, there are more than 12 localized community liver advocacy organizations representing more than 40 states and 2 countries within our Liver Action Network. They will be vital allies as we continue to maintain that liver health policy drumbeat. And then also our Advanced Advocacy Academy, which is our patient engagement and training program, advocacy training program, which really we like to see is almost advocacy school. And our patients come out and are well-educated and prepared. Some have gone on and started their own advocacy organizations, which we could not be more excited about. And some have participated in FDA advisory committees and, of course, congressional briefings on Capitol Hill. But both of these kind of departments within our organization are critical tools that we will use to follow through on the next steps with AASLD's Public Policy Committee and AASLD overall. And then I wanted to also, I won't go through all of these, but just briefly highlight, as you can see, there's been a lot of successes over the last 12 months. And a lot of these actions are, again, in large part, thanks to collaboration between our organization, organizations like the Hepatitis B Foundation, and of course, AASLD as well. And then our work collectively through the Public Policy Committee and other coalitions as well. So, I mean, as examples, urging United States Preventive Services Task Force to include NASH in the conversation with their prediabetes and type 2 diabetes screening guidelines that they released last year. Or some of our recent externally led patient-focused drug development meetings on NASH and PBC with the FDA. And then, of course, a variety of congressional actions as well, which, includes congressional briefings, which we had a NASH briefing in partnership with AASLD last year. And then, of course, advocacy days as well, which we will have our advocacy day next week, which again, maintaining that drumbeat of liver advocacy on Capitol Hill, which is really the way we will see success. So the last slide, I just wanted to kind of zoom out one last time before I hand it over to Rhea. And this is how we see the advocacy world. And it's really important to underline, again, the value of collaboration. Each of these viewpoints on their own have value, but they are not going to be able to shift the conversation in liver health policy on their own. You have the patient organizations like ours and Hepatitis B Foundation, NVHR, and more. You have industry, you have coalitions, which I put two of our councils, three of our councils here, but also includes, Hepatitis Appropriations Partnership and trade associations like pharma and bio, and then of course medical societies like the American Association for the Study of Liver Diseases. To really shift the conversation, it is all of these players working together, and I think this is what is exciting about our webinar today, is we'll be able to talk about this value in a little greater detail. But also, I think, I really want to underline again that each piece of this is so important, and that's why I think we're so happy with our continued collaboration with AASLD. So with that, I'll turn it over to Rhea now. Thank you.
Thanks, Andrew. I'm going to pull up my slides. Okay. So hi again, everyone. I'm Rhea with the Hepatitis B Foundation. And I just wanted to kind of similarly give an overview of how our organization, as one of many that AASLD collaborates with, has found opportunities to increase patient engagement and advocacy alongside physicians and medical groups like AASLD. And so I'll be presenting more specifically kind of from our perspective, working in the hepatitis B policy space, but know that a lot of what we do is in broader coalition with viral hepatitis groups, liver health, cancer advocacy groups, infectious disease or immunization groups. So while we come to the table with hepatitis B specific policy asks, it really works to be able to bring our expertise to broader advocacy efforts, like what AASLD does for Hill Days and for what other coalitions do, so that we know that hepatitis B is always represented and that our voice is kind of amplified by partnering with these other organizations. So just to give a quick overview of what we work on. So again, I work for the Hepatitis B Foundation, but we also manage a national coalition called Hep B United, which is a coalition of state and local community-based organizations and coalitions. So it's a coalition of coalitions working on reducing the health disparities associated with hepatitis B. And a lot of our advocacy work actually kind of happens on the ground in partnership with these organizations, which can be nonprofits, they can be student groups, they can be community health centers and clinics, research institutions, all sorts of partners. So, and I know a lot of them work directly with providers in their areas to strengthen kind of their voice and the work that they do locally. But kind of from a national perspective, what we all kind of try to focus on or prioritize, it all falls within mostly one of these categories here. So we work on federal funding for hepatitis B and liver cancer through appropriations advocacy and through bills like the Liver Act. We work on prevention of hepatitis B through trying to advocate for universal or expanded guidelines for screening and vaccination. We also do advocacy around treatment access, ensuring affordability and access to hepatitis B treatments, and combating hepatitis B related discrimination, which we're seeing happening within healthcare student and professional programs, as well as within the US military. And then kind of underlying all of this, or being part of all of our priorities, is a focus on health equity, particularly with hepatitis B and liver disease disproportionately impacting certain racial and ethnic communities and other at-risk communities. So health equity is a big priority there. And then how we do all of that, this is a lot on these next two slides as well that I won't kind of go into detail about all of them, but just sort of examples of how we advocate. And again, a lot of this we do increasingly more and more alongside patient advocates, family members, caregivers, and providers, and our other community partners. And I tried to put a star next to ones that we have that we're either currently or have previously worked on, specifically with AASLD and other organizations on this call. So as Andrew had mentioned, I mean, a big thing is funding within our congressional advocacy. And so last week's Hill Day, we focused on one of the things within our funding ask was around the Division of Viral Hepatitis at CDC and the report language for to support the newly updated hepatitis B vaccination guidelines. So that's to see that supported, to see that message carried by AASLD members during the Hill Day last week, to have that unified voice supporting that was really great. We were really happy to see that, because in historically, I guess, with hepatitis B falling within a larger category of liver disease under viral hepatitis and all this, sometimes it doesn't get that much attention. And so it was great to see it prioritized by members last week during Hill Day. We work on legislation or support legislation like the Liver Act, like the Health Equity and Accountability Act, and the Multi-Cancer Early Detection and Screening Coverage Act. So again, with trying to find opportunities where hepatitis B advocacy fits into larger priorities that perhaps get more attention, like around cancer screening. So that's also a big opportunity. Try to support and work with our champions to introduce resolutions around specific awareness days throughout the year. And of course, participate in virtual or in-person Hill visits with members of Congress, whether that's a dedicated advocacy day or ongoing meetings that happen with other coalitions like the Hepatitis Appropriations Partnership or the Adult Vaccine Access Coalition. Sometimes those coalitions are scheduling meetings all throughout appropriations season, and we try to have representation there. And then engaging with various congressional caucuses that focus on hepatitis or Asian Pacific American health issues, or the Deadliest Cancers Caucus. So that's kind of overview of congressional and legislative advocacy. We do administrative and regulatory advocacy, again, kind of similar to what Andrew had already talked about, with meeting with specific agencies, and we're submitting comments or letters whenever they open up comment periods. And one big example too recently is with NIH had put out a request for information while they were updating their strategic plan to cure hepatitis B. And this was an opportunity that we were able to draft some comments, share that with AASLD and with other partners, and get sign-ons for it. To really show that there was broad support around prioritizing certain research areas and things like that to be included in this trans NIH plan to cure hepatitis B. And I think having the collective voice of both patient advocacy organizations and a provider organization and others was really helpful, because our staff had a follow-up meeting later with NIH, and they talked about how helpful it was to have the consolidated comments all organized, and to see the different organizations and types of organizations that supported those comments. Events and webinars are a big part of our policy and advocacy programming. So webinars like this, or issue-based webinars going over specific policy and priorities. Recently, we've started doing state-focused advocacy calls and trainings, and then we try to stay up to date with conferences and exhibition opportunities. So attending the liver meeting and having an exhibit there, or having patients attend and be part of sessions has been a great opportunity in the past couple of years to have representation and to have those like networking opportunities between patients and providers. This is just a list, just more examples of coalitions and partnerships, ones that we've mentioned already, like our Hep United Coalition or the Hep Appropriations Partnership. We participate in GLI's Liver Cancers Council, and then all of the opportunities with AASLDs, not just the Public Policy Committee, but other committees. We've nominated people from the hepatitis B community, from the research community and the patient community to be part of those committees, which again has been like a huge opportunity to increase the dialogue and the representation between the discussion between the different groups, and to have more collaboration on developing policy. State and local coalitions and work groups. Within the hepatitis world, there's a lot of state elimination planning happening right now. So we try to encourage our provider network through Hep United, as well as our community and patient network, to join these state-based coalitions and work groups that are trying to develop plans to eliminate viral hepatitis in their states. So that's another great opportunity for cross collaboration, and looking at, again, other student groups too, like medical student groups, even nursing students. We try to do webinars and things like that and involve them in advocacy as well. And then the last thing is, I guess it's the biggest thing that we're here to talk about today, is kind of the grassroots and patient engagement aspect of all of this. So at the Hep B Foundation, we do have an online action center where we try to, we send out action alerts that are when they're timely, and we send out newsletters about advocacy opportunities. We've hosted different petitions on there, and we found that like the digital advocacy space is a good way to connect with people initially, and then follow up with them to try to get them to attend more trainings or to participate in Hill Days, but starting with sort of just the digital advocacy. And then we've really increased our patient engagement and storytelling programs as well. We have for awareness and advocacy, we have the Just Be Storytelling campaign, and we have a Be the Voice international story bank, as well as we're trying to start another as an offshoot of that, specific story banks related to policy issues. One example is trying to collect stories about issues with treatment access and affordability. And so that's one way that we're trying to collect stories, actually both from patients and also from providers who are working with communities that are having issues with affording their hepatitis B treatment. We have Global Community Advisory Board that we're launching to help bring the patient voice into the process of drug development and to inform clinical trials. And similar to GLI, we had a patient-focused drug development meeting with the FDA 2 years ago now to talk about hepatitis B drug development and clinical trials. So all of these opportunities, and in all of these opportunities, we really see that it's important to engage the community, not just those living with hepatitis B, but the broader healthcare space and the people, the community organizations and physicians who work on hepatitis B, or who work in this space in general. So just wanted to close with this kind of just a slide of some of our patient advocates in action at various summits, speaking at congressional briefings, attending Hill Days in person, and just emphasizing how important that has been, and how much we really do want to continue to encourage people with lived experience to be part of, to connect with the AASLD community and physicians in their area to encourage people to take action around hepatitis B and liver disease. So I think that closes out the presentation part of the meeting. I think I'll turn it back over to Mike and our moderators.
That's great. Thank you so much, Rhea, and thank you so much, Andrew. I'd like to now turn it over to our moderators, Donna Cryer and Michael Lindberg, to facilitate a conversation around these public policy questions and issues. And this is the opportunity for any of you who are attending here today to get your questions asked. I know that our marketing, we asked you, what is your one big advocacy question? So this would be your opportunity to do that. And I'd like to remind you to either do that, please, by raising your hand in the raise hand feature in Zoom, or to add your questions into the chat box.
I guess I'll start. I'll start with thanks to everybody for attending this. Thank you to Andrew and Rhea for such a comprehensive presentation, and it really does underscore the title that that we had chosen for this presentation about building on the positive momentum. There's so much positive momentum that the two of you demonstrated, both in collaboration with AASLD and within the two organizations, that it seems to be a good time to be a liver health advocate these days. My first question maybe is to Rhea. You talked about the power of having a unified voice. Liver AASLD has such a challenge creating a unified voice out of so many different types of liver disease and so many organizations within it who look to it. So how does the Public Policy Committee create consensus and create that unified voice and a succinct set of policy asks, because you can't go up with the whole laundry list on the Hill. You really have to just have one or a few. Tell us about how that Public Policy Committee process works to create consensus.
Yeah, that's a good question. And so this is my first year on the Public Policy Committee, but it was nice because we jumped right in order to prepare for the Hill Day. And so I think from my very first meeting, we had kind of, after introductions, started thinking about what would be included in the asks. But I know that there is a broad, even just in that subcommittee, there's a broad representation of types of like what sort of subspecialties the providers had. And then I think it's Andrew and I as the two patient advocacy groups. So I think we may have the broader perspective, but I think it was useful that we had sort of the AASLD advocacy team first sort of present like what's the broader landscape of what's going on in Congress right now, where would like liver health priorities and general funding increases, like how does it fit in, what's reasonable right now in this climate, what tie-ins there are to, not kind of like with COVID and everything, like seeing infrastructure around public health and immunization potentially being strengthened, like so sort of those aspects of like the policy landscape. And then there was some documents circulated with like a draft of potential report language and appropriations requests that we all got a chance to look at. And then for the funding requests, I think Andrew talked about this, some of these requests are coming from an even broader community. So that's AASLD will look to the Viral Hepatitis or Hepatitis Appropriations Partnership, which also in itself has to come through a consensus process to come up with an ask for what they want to see in terms of funding level. And so I think it's good that the team and the Public Policy Committee looks to those other partners to make sure that it is, we're not just coming up with numbers on our own in isolation, but we're looking at what else is happening with advocacy groups. But yeah, it is my first year on the committee. So if maybe Andrew has more to add on how those priorities are developed.
Yeah, Andrew, you are the experienced Public Policy Committee member, at least from the community representatives. And I noticed, I smiled when you had standard course of action as the title for your slide, because of course, involving community members hasn't always been standard course of action, although AASLD has a long history of partnering with patients on their Hill Day, but this level of engagement is now the standard course of action, and that's very exciting. But your views on how you all forge consensus on the Public Policy Committee?
Yeah, I mean, I think so. First off, Rhea gave a great kind of overview there of how we reach a lot of our viewpoints. I will say the committee really leans into the people that have experience or the people that are more versed in the policy world. So individuals like Rhea and myself that are actively involved in, liver health advocacy on a daily basis. bring a certain viewpoint to this discussion, that when we're zoning in on a priority, we kind of surface some points that are taken into consideration when we develop the plan. But then also, to Rhea's point, level setting at the beginning on what is the current challenge, what is the current kind of dynamic and political environment at the moment. So if you notice, last year, some of our priorities hit COVID-19 a little more, but obviously, and that is an ongoing public health issue, but is maybe not carrying as much weight as it once did on Capitol Hill. So adjusting and understanding the current dynamics and adjusting our priorities is critical. And obviously, that's really why we zoned in on an appropriations ask and a dollar amount, because that is such a critical concern that impacts so many of us at the moment. And Congress is scrambling right now to get federal funding. So there was an opportunity for us to really try to hopefully get our asks in there. So it's understanding, as Rhea mentioned, what is going on currently, and then using our experience and those that are on the ground to kind of add flavor to it.
Fantastic. Michael, I thought I had lost you for a moment, but I'll hand the next question to you now that I do see you on my screen. Oh, and then I see a hand up from Joe. Can we allow Joe to ask a question before I hand it to you?
Sure. And I was going to say, I want to get to questions from the folks. So yeah, Joe, please.
Thanks. I couldn't find the raise your hand button.
No problem. I saw your hand.
The old-fashioned way. Well, I don't know if this quite fits the subject of this meeting, but my advocacy and education has been one-on-one and with small groups I've been involved with, like my gay men's group. And I'm wondering if there probably is, if I just look carefully on hepatitisb.org, but are there any media, like someplace I can go for talking points when talking to individual small groups or at meetings, about hepatitis B and D?
I think Rhea's probably got an answer for you there.
Well, yeah, in terms of advocacy talking points, we I guess typically we prepare one-pagers around our asks for that year, around the time before we would have like an organized Hill Day. But that's not to say that those materials wouldn't be useful throughout the year. It's just that they also include some specific asks for that appropriation season. But we do have fact sheets, a lot of fact sheets on our website, and maybe more so if you actually have hepb.org, but we also have hepbunited.org. If you go to the advocacy section, we have more resources there currently that are focused on advocacy, and it has like that first slide that I showed of the priorities that's listed out there. And that is something that we're, especially with our state advocacy calls and trainings that we're doing recently, we're trying to develop more materials like that, Joe, so that you can take them to different groups, take them to meetings with local and state legislators. But for right now, that's what I can think of are sort of our previous Hill Day fact sheets and general fact sheets. But that's a good resource.
I would only add quickly too, and this is less specific to Hep D or hepatitis delta. You could utilize those fact sheets that Rhea mentioned and join our Advanced Advocacy Academy as well, which is going to be more advocacy tools, less specific to hepatitis, but will hopefully give you some of those tools of how to, communicate, whether that is at the state level, national level, or in other aspects. Because I should mention, we're really taking an advocacy and policy angle today. But advocacy can have many different angles, and that could be advocating to the media, advocating to your provider, as working closely with AASLD, advocating within your community. So there's a lot of different angles, and I think our A3 program could complement a lot of what Rhea was just talking about as well.
Yeah,
Yeah.
and Rhea mentioned the Hepatitis Appropriations Partnership as well. I think that's a great arena to just get general talking points around viral hepatitis, hepatitis B as
What
well.
was
And
that?
I'm going to put the listserv email in the chat. The Hepatitis Appropriations Partnership, and it's really a group of advocates, patients who focus on appropriations in the Congress every year, and there's a very deliberative process in coming through with priorities, and a lot of those include some of the talking points that you were asking about, Joe. So if you just send an email to that hepfunding@googlegroups.com, you should be able to get on that listserv, and there are monthly meetings, and it's a really great place to just get engaged with more patient advocates, but also kind of, if you're interested in the policy side, a good place to start. And thank you for that question. I did really just want to also recognize how far AASLD has come in the last 4 or 5 years. For a very, very long time, many of us had advocated for having more patient and advocate involvement in the liver meeting, in committees, and for a very long time, nothing happened. And about 4 or 5 years ago, through the leadership of some of the folks on the call, Mina, Racho, others, there was an understanding of the value and the real synergy in having patients and clinicians discuss a lot of these issues together. And I think there's nothing more powerful for a policymaker than having a patient and a clinician in his or her office telling their stories. And Hep B Foundation, GLI, MVHR, I think also in the last 5 years or so have done an incredible job of really centering the voice of patients and elevating that patient story. So just wanted to recognize the great work that AASLD has done. And then Mina, you have a
Yeah, I was thinking, as Andrew was saying, like, you guys have another advocacy event, if you will, next week. Is that right? Is that in person or is that virtual or?
Virtual still. We
Yeah.
do hope to have a hybrid one in September. So I'll say that as well. We're still, fingers crossed that things open up a little more on Capitol Hill, but yes, yeah.
But what you had said struck me was that it's kind of like this constant message. Like, it can't just be like a one and done, kind of a thing. And so I was thinking if there was some calendar of everybody's advocacy event, so that others could support each other's advocacy. So just like you said, everybody's got their liver disease of interest, but doesn't mean that the others don't care about that liver disease. Just you can only, as a group, maybe sometimes focus on one. But in terms of manpower and having just that kind of, if we had a calendar of all of our groups' advocacy events coming. And then the other side of it is, if there were, and you guys probably have already identified your physician partners for all of your things, but if not, there may be also AASLD members who could be in this kind of willing to join you, because you were saying it's that partner, physician patient partnership that's so powerful. So yeah, there's Hill Day, but then if you're doing an event and, somebody would be willing or interested in joining, again, you may already have that. So I'm not saying, that might already be there, but at least the calendar of events so that others from other organizations can join.
Right.
That's a great point. Sorry, go ahead.
Yeah, I was going to say, I think both are great. Having about the calendar and having a pool of willing physician partners is so important. And I actually wanted to make sure that I did call out, in addition to AASLD as an organization, AASLD members have partnered with every single organization who is on this call. And we really could not do our work without those medical advisory boards and those policy committees and the physician representation in those. So, Andrew and Rhea, I'm mindful of time, and one of the questions that was sent in before, and Rhea, I noticed it on your slide deck, and Andrew, I know you were co-author as part of the Public Policy Committee on a paper on health equity. So maybe Andrew, I'll start with you. How do issues like health equity bubble into the Public Policy Committee, and how are you starting to integrate that into the overall policy agenda?
So I think it's always, kind of central to the issues we discuss, health equity. And I will say, thankfully, we have great chairs of the Public Policy Committee now who prioritize health equity. But also connected to that, I think the way we have really decided to zoom in on it, so to speak, is our work directly, as you just mentioned, with many of the kind of individuals that are part of the Public Policy Committee. When we submitted comments on the Health Equity and Accountability Act, we interacted with many members on the Public Policy Committee to get their thoughts on how we can make, as an example, clinical trials more diverse and ensure that those are appropriately included in legislation. Obviously, making sure that diverse voices from our patient population are represented in these meetings as well, and in the conversation when we zone in on priorities. But yeah, and I did want to add one other piece too, kind of connected to that, is that, outside of the Advocacy Day, a lot of times the best way to kind of highlight these points, especially on health equity, is through, congressional briefings and initiatives like that, where you bring the spotlight onto an issue and you have diverse voices represented. We partnered with not only on AASLD with a NASH briefing last year, but obviously the Hepatitis B Foundation as well on the Liver Act, and ensuring that our patients, diverse patients, are there presenting to Capitol Hill, and that we also have the clinical perspective represented is critical when we're taking the health equity lens into consideration.
That's great. And congressional briefings have definitely been an area where I've seen our partnership and collaboration with AASLD formally, and I think that it does send such a powerful message to the members of Congress that we stand united as patients and physicians together on these issues that we spotlight. So we talked, this is about momentum. So we had Hill Day, we have GLI and other advocacy days coming out throughout appropriation season, but throughout the year, how can people, let's make sure before we leave, people know how they can stay connected. Now that we're going to have the calendar, but how can they stay connected to be able to participate in these advocacy days and Hill days? It's like a game show. Who's closest to the unmute button? I should direct them. So Rhea and then Andrew. I should know better as a moderator by now.
So I did put I put a link or the URL in the chat a few minutes ago to our advocacy kind of sub page for the Hep United Coalition, and that for us, if you subscribe to our Action Center, that's one way that we send out information on upcoming events, whether it's advocacy webinars or Hill Days or other ways that you can take action just from home. Like we send out template letters to support, for example, for the Health Equity and Accountability Act or for Hepatitis Awareness Month, we'll probably send out an action alert, that you just fill out your name and zip code, and you can like customize a template letter that we'll provide, and that message will go to will be routed to your representative in Congress and your senators. So that's one way, I think the best way maybe to get involved initially. And then if we're looking to get connected with coalition partners, so people that any physician advocates that are in our network that may be in your state or in your area, we do try to make those types of connections. And I think we will try to do more of that, especially if there's a calendar for events or if there's this kind of directory of speakers because I do agree, just to agree with everybody about how helpful, the pairings were last week for Hill Day. Sometimes I've been part of a lot bigger Hill Day groups before, or people on their own, but it was kind of nice. This time was just like, to have one perspective that is like more clinical, but then another perspective that can bring in other types of stories and broader facts and things like that from the community. It was nice to have that, I guess, to like fall back on each other on various talking points and fill in gaps where needed. And so I think the more we can pair people up locally to get to know each other, to do advocacy throughout the year, the easier it is when we like come together for these one-day events or Hill Days.
Excellent.
And I'll just add quickly, and I know we're getting close to time, but for us, really would suggest, if you're interested in becoming an advocate and also taking tools to other organizations and other advocacy days that are not even part of GLI, our Advanced Advocacy Academy, and I include the link there. We have a variety of events incoming, and we will have another advocacy day in September. But I did want to mention as well, just from a calendar standpoint, even though we don't have one, some upcoming events. And I know Hepatitis B Foundation will be doing a variety of events in May as part of Hepatitis Awareness Month. So there'll be a lot of opportunities to advocate there. And then we will have a caregiver summit in early May. We'll talk about some of the challenges that caregivers experience, but also how to balance mental health aspects and caregiving and more. So that will be another exciting aspect. And then our International NASH Day as well in June. And then of course, many other opportunities throughout the year also, but just at least the next few months, May and June coming up, a lot of exciting opportunities to advocate.
A lot of those events are featured in the liver health policy update. And I remember reaching out to AASLD when the thought occurred that for advocates around the country, at least, who didn't get the Federal Register, didn't have, law firms or lobbying firms call them and alert them to things, that there did need to be this resource. But I just, wanted to recognize that my first instinct was to call AASLD and their policy experts to ask if that would be of value. And we've worked collaboratively, on that. They send items and things to be able to share, so that advocates would have an easier way to, to weigh in on the many events that happen around all the different agencies that you all have mentioned. So that's just another avenue if you wanted to subscribe to that. Michael, I'll let you close out because you have such a wonderful view of advocacy and this positive momentum that we are building, but you have been so much a part of creating it.
Yeah, thanks. And an anecdote just occurred to me, and Mina and Rhea alluded to it as well. These aren't one-offs. Advocacy is really, it's building and nurturing relationships. And when I started doing this work, I actually was an intern on the Hill in the 80s, but started doing this work professionally about a little over 20 years ago. And one of the first legislative sessions I had, real work to do here in Olympia about 20 years ago, we were pushing for a state strategic plan for hepatitis C. And this was, in the interferon days. And we didn't get it, but it was close. And I was very disappointed. I was a young man then. And in kind of debriefing with the Senate Health Committee chair, she told me, Michael, this is a game of inches. You moved the ball downfield this session. You didn't get what you wanted, but you're going to come back next year and you're going to be in a better position. You'll have a lot more legislators who know more about your issue. And as it turned out, we actually did get the legislation passed the next year, which is also rare because it's often a lot more than 2 years, if ever, that you get something moved. But that was really a great lesson for me. And it is, again, keeping those relationships intact and making sure that you've got this amazing community and so many people who have different stories to tell, whether it's from the patient perspective or the clinician perspective, and bringing those stories together and really nurturing those relationships with policymakers. So it is a long game. I'm thrilled that in the president's budget 2 days ago, we had an historic increase in the budget for the Division of Viral Hepatitis, an almost 30% increase, $13.5 million on top of their normal budget. We'll see what Congress does with that. But again, that's years and years in the making. And we've been pushing for that for 15 years or more. So with that, I'm thrilled that we had a great turnout today and a great Hill Day last week. Wonderful to see everyone, and we'll look forward to doing this again sometime soon.
Absolutely. Thank you.
Thank you,
Thank you.
everyone.
Thanks,
Thank you,
everybody.
everybody.
It was
Have a great day.
Bye, everyone.